Thank you, Mr. Speaker. History has taught us that central planning and big bureaucracies do not work, and that's precisely what the Super Board is. The proof that it is failing continues to mount. The Auditor General said this week that the board can't keep track of its budget. Yesterday, even the Super Board's CEO confessed that the inefficient AAS has continued to put people in the wrong bed. To the Minister, given that patients have no confidence in the Super Board, staff has no confidence in or support for the Super Board, and now even the CEO is admitting doubts, when will the government dismantle the Super Board and return control to our local communities and hospitals?
The Honourable Minister.
Mr. Speaker, I don't know how many times I've stood in this House and indicated that the centralized, single, province-wide board is working very hard as a new entity, bringing in information in a more consistent fashion so that we can make important decisions to improve health outcomes, such as a 5-year funding commitment, such as a 5-year action plan that's coming out very soon, such as performance measures, and a host of other things. And also, having said that, please let's note that the Alberta Health Services Board has actually reduced the number of CEOs and others who are part of that bureaucracy.
Mr. Speaker, that answer was farcical. It's unbelievable. Given how ineffective the Super Board is, the Minister's new ER wait time targets are just empty rhetoric. Given this government only responded this week because the public were made aware of the crisis by ER doctors, the AHS needs to be open and accountable to Albertans. The only way to do this is to publicly disclose all the ER horror stories like those released last week. Will the Minister commit to putting all suboptimal triage reports online immediately?
Yes or no? The Honourable Minister.
Mr. Speaker, if the member had been listening yesterday, I asked and directed Alberta Health Services to report on a per-site basis what's going on in the emergency rooms with respect to the protocols that are forthcoming. Albertans want to know how their particular hospital in their area is performing. They have a right to know that. They've told us they want to know that, and that's why I announced yesterday that we will be doing that. What more accountability can you have than to look at each hospital on a per-site basis and be accountable for those results?
The Honourable Member.
That's excellent, Mr. Speaker, so long as that's the full triage reports and not just that the wait times are 4 hours. But given that the ER problem has been escalating for years now, this government has known since March 2008, but it's only getting worse. How much longer will the Minister go on defending the Super Board while withholding the documents that enable Albertans to see the true state of affairs of our emergency system, why the Super Board must go? When will he put the full triage reports online?
The Honourable Minister.
Mr. Speaker, I agreed to follow up within 2 weeks, perhaps even sooner, with the emergency docs regarding a number of their issues. What we're talking about here are the Tier 1 performance measures. There will be some Tier 2 level performance measures, which people on the other side, I'm sure, understand. And as part of that, we will be reporting back to Albertans with what it is that Alberta Health Services has in mind and what they have accomplished by way of providing better health services in the emergency rooms and in other parts of the system as well. It is working, it's coming together nicely, and it's all because of the 5-year funding commitment that